poor, misunderstood testosterone. Why does conventional medicine hate you so much? Where's the source of all the fear and loathing? Maybe it emanates from our puritanical background. You know, the idea that testosterone is the devil. It gives men aggression. It makes them horny. This is all the things that we hate about toxic masculinity, and it gives women beards. We all remember those East German swimmers back in the old Soviet Union days. Well, maybe we don't. But the point being that there's a lot of inbred cultural bias against testosterone. And it's been propagated through a lot of false thinking that has taken decades to break down. So let's look at it. Where is the risk? Testosterone is essential to life. Without it, we die. The species doesn't exist. There are testosterone receptors in every cell in the body. They're in the brain, muscle, the heart. Yes, they're critical for sex drive. They're critical for sexual function, but it's way more than a sexual hormone. Without adequate testosterone, your brain doesn't work as well as it should. The speed of conduction from one neuron to the next slows down. You can end up with word-finding difficulty, brain fog, irritability, short-temperedness. You lose resilience toward friction. This is very common. Now we'll talk about the risk or the fear with regard to women. Testosterone is the most abundant female hormone. Yeah, that's right. Ladies, you need your tea. Without it, you're going to get grumpy. Perimenopausal women, this is common. And you're like, I don't know, 30s, 40s. Got kids are bugging you on one side, a career, a husband, maybe parents are getting sick and infirm. Life is stressful. You start to feel not so good. You start to feel a loss of sex drive. You gain a little weight in the midsection. You're not so happy. You get short-tempered and irritable. I've heard this story generational from women that tell me about their mothers who morphed into something different. In many cases, it's testosterone deficiency. And a little testosterone can change everything. Critical for women. What about cancer? What about breast cancer? It seems to me that people who are anti-hormone love to tie these things together. Well, guess what? It doesn't work for testosterone at all. Doesn't work for estrogen much either. But the focus today is on testosterone for men and women and why there's such fear and loathing. Historically, that's the concern. It's going to give me cancer. Doesn't do it, folks. In fact, testosterone is anti-proliferative. There are studies supporting that it can suppress breast cancer. Women on testosterone therapy had lower incidences of breast cancer. Women with breast cancer are now being treated with testosterone. In fact, there's a drug in its final stages of research. Enobosarm is the name of the drug. It sounds like a tribe in Africa. Enobosarm is the name of the drug. It's going through the FDA approval process right now, and it is a testosterone analog. It stimulates testosterone receptors. And what they're finding is that women with stage 4 breast cancer do better with this drug, even those who have estrogen and progesterone receptor positive cancers. They live longer. They live better. Fascinating. Begs the question, why are you producing a drug when we have testosterone that, in fact, hits testosterone receptors and is a much more natural way to do it? Why not just give women testosterone? The answer to the question is you cannot patent testosterone. It's generic. For a drug company to turn testosterone receptor stimulation into a profitable product requires a patent, requires a drug that is unique and separate from testosterone, even though it does the same thing. Now, in order to sell this to women and to the medical community at large, they're going to have to make you fear testosterone even further. They're going to say, this drug can do what testosterone does without all the negative stuff, acne and hair growth and all the folks, that doesn't occur unless you're getting you're getting treated by a provider who's not sensitive, thoughtful, and knowledgeable. Properly dosed testosterone in women is a gift to mankind. You will be stronger, smarter, faster, better. And no, you're not going to grow a beard. And no, the breast cancer rates is no evidence that it's going to increase. None. So I'm seeing a lot of positives here. I'm not seeing a lot of negatives. And oh, by the way, I've been doing this in my practice for 15 years. Very grateful women, very grateful families, very enriched. It does not hypersexualize. It restores normal baseline. It does not cause aggression. You know, the aggressive, grumpy, miserable old man or grumpy old lady, they're testosterone deficient more likely. Testosterone has a calming effect in the vast majority of people. So fear for cancer, not there. For breast cancer. How about prostate cancer? Isn't testosterone going to explode my risk? Well, that was the thinking for many, many years. It's remarkable how in medicine, dogma becomes petrified. We've been talking about this a lot with regard to the PSA and prostate cancer treatment. It's very hard to get doctors in medicine to move from an established belief system, even if the belief system is built on weak ground. And thus it is with testosterone and prostate cancer. I have to credit Dr. Abraham Morgentaler and his fine book, Testosterone for Life, as being a real thought leader in this space. It turns out that the doctor who originally associated testosterone with amplified cancer risk or with stimulating cancer that's already there, based his findings on a single case, one case. It became dogma. It became part of the accepted fund of knowledge that was unequivocal. And now it's being challenged, and it should. It turns out that men with low testosterone have higher cancer rates. It also turns out that there is not a direct association between the blood level of testosterone and the level inside the prostate gland. In other words, the prostate gland reaches a saturation point of testosterone, beyond which has no effect. So a man can receive therapeutic testosterone therapy, enhancing his vitality, libido, strength, energy, decreasing muscle aching, stabilizing arthritic joints, improving cognitive function, all fabulous, without worrying about, is it going to give me prostate cancer? Evidence does not support that. That's not just me saying it, that's consensus opinion amongst andrology specialists like me, people that do this all the time. And look at the research as well. Look, if you're on testosterone therapy and you're a woman, you can still get breast cancer, but the testosterone didn't contribute. Same thing for men. If you're on testosterone therapy, you can get prostate cancer, but the T unlikely to have any factor in that event. What about the PSA levels? Testosterone therapy does not, by and large, increase PSA levels. You have evidence of this over many years, hundreds and hundreds of patients. If your PSA goes up, it's not usually associated with the testosterone therapy. Well, what if you have a high PSA, an abnormal MRI, and you're fearful that if you put testosterone in your system, you're going to pour gas on a fire? Turns out not to be the case. We're looking at the research regarding men who have abnormal PSAs, abnormal MRIs, and we're just not seeing it happen. This idea of prostatic saturation is real. The concept that testosterone therapy is going to explode prostate cancer is a widely held fear that deserves to be put aside. You should not stop your testosterone therapy because PSA went up. You should not abandon its benefits because of the lab test. It's worthy of reflection, and we all have to make our own decisions, guys and gals, right? What do we want to see happen for our health? I'm an advocate of taking advantage of a known benefit, especially when weighed up against a theoretical concern that research does not support. So men, if you're feeling symptoms of low testosterone, you needn't fear your prostate being at risk because you're now on testosterone. Now, we are gathering growing experience with men who have prostate cancer and have chosen to go on testosterone therapy. Now, that is not standard of care. Standard of care is to castrate them. But there's a growing cluster of men that just don't want to live that way. And they say to me and to doctors like me, doc, I understand the prevailing dogma. I understand the theory that giving testosterone will accelerate prostate cancer growth. I understand all that. I'm also cognizant of the fact that that theory may not be valid and that there's growing evidence that it doesn't hold. Therefore, in the contest between a theoretical adverse effect and a tangible benefit, I choose the benefit. Men should have their prerogative honored. So I have some gentlemen in my practice who were on testosterone therapy, developed prostate cancer. The testosterone therapy was stopped, and their quality of life collapsed. Their executives, their leaders, their brain didn't work right. They couldn't keep up at work. Their relationship with their wife started to decline as they became physically disconnected. Libido faded, erections faded, strength, confidence, the big variable. And upon reflection, they opted to go back on testosterone therapy, and thus far, thriving. Will they someday die of prostate cancer? They may, but that may have occurred anyhow. So you have to think about the risks based on the best research and not an emotional reaction based upon previously held beliefs that have been since repudiated to a large extent. So testosterone is safe for prostates. It is safe for breast. Well, what about the heart? I've heard that it's going to cause hardening of the arteries. Once again, the information does not support that consequence. A study looking at men on testosterone therapy found no increased incidence of heart attack, stroke, none. They found that the men had better strength, better libido, lean body mass improved. This was a published study in the New England Journal of Medicine. They looked at these parameters. What I found interesting, so those findings are very affirmative. The conclusion of the article reflected the mainstream medicine's bias against testosterone. Despite absence of harm and despite evidence of benefit, the conclusion was, yeah, but we still don't recommend testosterone therapy. Well, why wouldn't you? Why would you say that it can help these things? They didn't consider improving muscle, improving the libido function, improving vitality. They didn't consider that valuable enough to justify testosterone therapy. How absurd. Falling and breaking a hip is a consequence that leads to early death, and it can be prevented by virtue of strength, power, muscle integrity, and bone integrity, all of which are improved by testosterone. I like to say my patients don't break when they fall, they bounce. They bounce. So testosterone and heart disease, there's no strong correlation. The evidence does not support hardening of the arteries. You think about it practically, right? Who has the most testosterone in the world? Young men. Do they get heart disease or cancer of the prostate? No and no. All right, I get it. That's kind of intuitive. The research, however, supports the same conclusions. Who's afraid of testosterone? You should not be. Is your family doc afraid of it? Is your urologist afraid of it? It's an uncomfortable space for them. Why? Because it's not been accepted as a legitimate medical need. Just because you're weak and feeble, just because, ladies, you've lost your libido, just because you can't lose that mid-abdominal fat, it's not really a medical thing now, is it? Because you're not getting a heart attack, you're not dying. The concept of that which is medical and justifiable versus that which enhances vitality and wellness are two separate spheres. And your insurance reimbursed conventional doctor has to stay within that lane. If they're going to ever give you testosterone, not only are they inhibited from the freedom to do so because of the prevailing dogma. But the dose levels, that's worth mentioning. How much testosterone should a man or woman receive? How do you know when the dose is correct? You can't go by blood levels. The blood levels are misleading. And here's part of the reason, because they are adjusted for age. Well, that's just stupid. I don't want the testosterone level of a 60-something-year-old man. I want the 35 level. That's what we're aiming at. What's wrong with that? Better vitality, better strength, better energy. All good. When testosterone therapy is rendered to men or women, got to remember there are two broad types of testosterone that we measure in the blood: total and free. The total testosterone includes that which is kept in storage form, not biologically active, cannot connect to those testosterone receptors. Only the free testosterone can do that. It turns out as we get older, we have a larger capacity to store testosterone, thereby skewing the lab test. So if the top level for the lab is, let's call it 700, and you test at 800 or 900, doctor's going to get nervous. Oh, your level's too high. What about the free testosterone? And more importantly, how are you feeling? The way to adjust testosterone is based on the symptom objective being achieved. I feel great, doc. My energy's good, libido is good, brain is clear. This is a good space. That's the right dose. If you haven't achieved, if a patient hasn't achieved the objectives, the dose should be adjusted upward, as long as there are no negative consequences. Estrogen levels can go up. They need to be monitored. The hemoglobin, hematocrit, the amount of red blood cells can go up. If it goes up too high, the blood can get too thick, present an increased risk of clotting. That needs to be monitored, but easily managed. How about like acne? If that happens, it's a sign that maybe you're at the upper threshold. But in the absence of any negative side effect, patients should be honored in their quest to get to the best level. Sometimes you don't know it until you're there. Same thing holds true for women. Same thing. If you're feeling great and all the symptoms are addressed, that's your level. Can the blood test tell you what to do? Doctors who use blood tests to adjust labs, and they use that exclusively, are manifesting a limitation in their appreciation of the functional aspect of the hormone. Look, I get labs. We all should. Monitor it, yes. It's reasonable. It gives guidance. But a lab should never neutralize or trump your experience symptomatically. So to fear testosterone, absolutely not. What else is good about it? Well, studies have shown that women who have had hysterectomies or men who've been castrated have a higher incidence of dementia. It appears that testosterone is neuroprotective. So once again, I ask, why is the world so afraid of testosterone? And why are doctors so scared of it? Look, I understand ignorance breeds fear. And unless a doctor or a nurse practitioner, provider, spends a lot of time researching the nuances of testosterone therapy, all they have time for is enough time to absorb the dogma. And that can often be a knee-jerk reflex. And just like that paper highlighted, even in the presence of redundant positive findings, the bias against it is still not always defeated. Every decision you make in life, whether it's to walk or drive to the store, whether it's to use testosterone or not, has a risk-benefit equation to be contemplated. It's not reasonable to require of anything, including testosterone, for it to be 100% risk-free. That defies practical possibilities. And it eliminates a lot of really positive things from happening in your life. Think about that. What can you do that's fun? What can you do that's good for you that carries like zero risk? Not many things. Not many things at all. So let's put testosterone in that category. Do you have to use it? Well, if you want to live your best life, I'd say yes. But it's your prerogative. And defining best life is subjective, right? For some people, they don't mind shrinking. They don't mind, the, oh, I'm old, I can't do it thing. I get that too. Sometimes it's comfortable to just say, well, I can't because after all, I'm X age and I'm old. You kind of get a free pass. Society will expect less out of you if you give them that mantra. I advise you not to do it, folks. Stay alive, stay vital. It's a better way to live life. Death will come, and when it does, your rest will be bestowed upon you. Until then, let's not be dogmatically fearful. Let's look at ways we can maintain our vitality. And let's give testosterone a new view. Man, woman, prostate cancer or not, breast cancer or not, the evidence is growing regarding its broad value. And these fear factors, who's afraid of testosterone? I dare say the ill-informed, the ignorant, the dogmatic. That's kind of not nice, is it? Shouldn't call them ignorant. Well, ignorance is not really a criticism. It just means a lack of knowledge. And sometimes knowledge changes behavior. Although it has been said that the way a doctor convinces his colleagues that he's right and they're wrong is to wait for them to die. It's hard. It's hard for an expert to change an opinion that has defined their identity. Well, folks, I hope you gained something today, a little bit of insight. The evidence is there. The evidence is growing. Look into it yourself. That's a beautiful thing, right? You can AI everything I said and read what's happening. Well, until next time, gang, it's been a pleasure. I'll talk to you then.